I will now propose a motion to convene an executive session to discuss confidential and privileged matters that may be related to threatened and potential litigation. May I have a second?
Second.
Okay, all those in favor, say yes.
Yes.
Great. We are now going into executive session.
We're moving or closing doors? We're moving. Okay.
It's such a mess here.
Do we take the materials or we get a new material there?
Let's take your breakfast.
Very important. Everything, the family. Sorry for the loss. Wow, we're the only ones?
You can follow me.
The less I have, the better.
Still hear it, right?
I'm not sure they could hear us.
It's green, no? When it's green. Oh, that's strange. Yeah, but you got that one.
You're back.
You recognize the name.
For the record that Anita Kawatra is in a listening capacity only. Please also note, in executive session, the committee received and approved the fiscal year 2024 corporate compliance work plan and the fiscal year 2024 audit plan. Next on the agenda will be an update from internal audits by Joseph O'Keefe. Okay, so
Okay. The first item we have on our agenda, or first item we have in our report, is a external audit that's being done by the City Comptroller's Office that deals with access to mental health services through the Department of Corrections, detainees within that organization. Right now, they're in a data gathering portion of the audit. We will update further as the audit goes along. The next audit we have is internal audit activities. The first item is system-wide review of nurse hiring. This audit has been ongoing for quite a while. We are updating sort of the post-COVID period for this audit to see if issues we found when the audit was originally done still exist within the organization. We're undertaking that now and should be done that portion shortly. The next audit is patient valuables. We are looking at the procedures in place at various facilities on the handling of patient valuables. Be any item that the patient comes in when they're being admitted, either into the ER or as an inpatient, or any of the other areas, and how we handle those valuables. We have completed our work at Bellevue. There's some of the different issues that were noted in there. The biggest issue we note in this audit is a lot of it is still done manually. There are a lot of paper logs that are maintained to record all the data. So as soon as you come in, you have to write down everything by hand, what the person has, and we're looking at possible improvements to speed up and make that process more efficient. We are going to be conducting it at other facilities. We currently now have ongoing reviews at Jacoby and Kings County. And those procedures will be, those audits will be moving forward in the next month. Part 5 is other activities. We are going, I have to explain this correctly. We're basically working on our risk assessment for the current year. We presented the audit plan. We are also looking at developing an overall risk assessment process. We're working with compliance to develop a sort of a unified risk assessment process for the whole organization, where with certain parts are done in conjunction with compliance and internal audit, and how we split off from there. The last item we have is auxiliary audits. These are the audits being done by an outside group, the Bonadeo Group. They are all audits of all our auxiliaries that fundraise for the organization. The statuses are shown on the last page. We are currently doing calendar year 22 audits. There have been delayed from some of the facilities, but has to do with IRS reasons and other reasons why some of the audits have been delayed by the firm. If anybody has any questions.
I have one question.
Yes.
On the patient valuables, that comes up with every hospital, and it gives us a bad grade because we're not ensuring the safety of them. Are we going to be able to develop a system-wide process, an automated system-wide process, or is that too ambitious a goal?
That would probably be the goal, I should say, but that's not going to be something that a determination internal.
Right.
You would have to look at the cost effectiveness and others of that.
Right.
What we're trying to do is make sure we do have some sort of a unifying process, that one facility doesn't have a really good process and somebody else is doing it poorly, and is it something we could carry across the board so that, however we can gain efficiency. Right. And ways of doing it, because the challenges with patient valuables are very unique in what qualifies as a patient valuables nowadays. We have everything from bicycles to marijuana to all kinds of items that come in as patient valuables. And some people come in with large amounts of cash and other things. So it is a very complicated process. And so it is good to sort of look at that process and see how we can best do that as a system as a whole.
Okay, thank you. Are there any other questions? If not, then we're going to ask for a compliance update from Karen Wilkinson.
Just on the other activities, Joe, this is sort of an ongoing, because we talked about your risk assessment.
Yeah, we talked about, we're sort of moving towards the 2020 fiscal year 2025 process at this point, but we look at risk assessment as sort of an ongoing process. Because new risks can come up at any point, and we try to maintain that conversation throughout the year, so we don't just pick up in April trying to set a plan for May. We want to have it, because we're looking at starting this year's plan somewheres in September. We're working with compliance to have a combined process done sometime around July, August, and then that we can move into September and sort of have a months-long process of doing this. Not constant meeting, but to get out and talk to the right people, it can take a while. And also just to make sure that we're not only taking a snapshot in time, that we're really are getting a good idea of what goes on during the year, what are the risks that are faced by each of the facilities, and we're getting a fairly solid plan.
But when I read this, I sort of think of it as you're doing a more comprehensive, is this, there's an outside consultant that is,
Oh, yes, we're working with an outside consultant to do the NESC plan, so that we're having this, compliance does a risk assessment,
Right.
we do a risk assessment. We're trying to combine as much as we
that was
can.
where I was getting to. It's
Yes,
like there's these two.
Because trying to get, say, to talk to one of the CEOs can be difficult to get in count. But if two people go talk to them about essentially the same thing,
Right.
they're going to see it as an inconvenience. We don't want anybody seeing it as an inconvenience, and it also,
Well, there's lots of synergies, I think, between
Yes,
any
yes.
two.
Exactly, like the
And what the-
risks are very overlapping, the
Right.
tools are a little different,
Mhm.
right?
yes.
Yeah.
And that's why we're sort of making it as efficient a process as we can, and sort of taking up as little of people's time as we can while doing this process.
Great. And that's something you'll share with the audit committee as
Yes.
we go through that.
Yes.
All right, now we'll move on to the compliance update from Karen.
Okay, great. So at the top of page 2, as you're aware, the system monitors exclusions of individuals and vendors through federal and state exclusion lists and databases. During the reporting period of March 14th through May 17th, there were 4 individuals or entities that appeared on the OIG or OMIG exclusion list. One was a potential employee whose offer letter was rescinded prior to employment. The other 3 individuals were agency employees from Right Sourcing whose assignments with H&H had ended prior to those sanctions being imposed. Thus, there were no exclusions that resulted in overpayment. There are also no providers that were identified on the Death Master file or the National Plan and Provider Enumeration Systems during the reporting period. Top of page 3, the system is required to notify business associates or patients of potential breaches of their personal information. During the reporting period of March 14th through May 17th, there were 52 incidents entered into the case management system. Of those 52, 17 were violations of system privacy and security operating procedures. 5 were not violations of our operating procedures, and 30 are still under investigation. Of those 17 that were violations, 8 were determined to be breaches. 6 of those breaches were the result of registration errors. 1 was the result of a medication list being given to the wrong patient, and 1 was the result of a release of information vendor disclosing medical records to the wrong recipients. Of the 98 privacy incidents that were reported during the April 2023 Audit Committee meeting, 35 of those were still under investigation at that time. 34 of those incidents have been closed. Of those 34, 18 were found to be violations, 16 were not violations, and of those 18 incidents that were found to be violations, 6 of them were determined to be breaches. Those 6 breaches were the result of 3 were an after-visit summary given to the wrong patient, 1 was a workforce member who's posted PHI on social media, 1 was the result of a document being scanned to the wrong medical record, and 1 was the result of a workforce member handing documents containing PHI of one patient to another patient without checking the documents to verify. The OCC received 1 letter from the OCR between the reporting period dates. On April 17th, we received a letter in response to the OCC's March 20th data request. Submission to the OCR regarding a patient complaint. The OCR alleged that the physician impermissibly disclosed PHI to the patient. PHI when the physician disclosed PHI to the patient's physician's family member. I apologize. In April 17, 2023 letter, the OCR concluded it was unable to substantiate the allegations and closed the case. During the reporting period, there were 47 compliance reports entered into the database. The database uses colored flags to represent severity of the reports. 2 of the reports were red flags, 21 were yellow flags, and 24 were green flags. 1 of the red flags was initiated but never completed, thus there was insufficient information to investigate. 1 red report alleged that the patient was mistreated by workforce members, and that was routed to patient experience for investigation. The database also tracks reports by intake and issue type, which is, yep, there you are, right there, number 14, bottom of page 5. And the issue types are at the bottom of page 6, and you can see those there. And the top of page 8. Billing and coding auditing services. KPMG has made progress since the last audit committee meeting. Their risk assessment and work plan are completed, and they have kicked off those projects for inpatient, outpatient, and ER and vendor coding retrospective audits. Samples have been selected for these audits. KPMG has halfway completed the inpatient audit fieldwork, which should be finished before July 4th, and fieldwork for the other audits have begun and should be completed by July 21st. Findings from the audits will be utilized in the planning and scoping of focused audits in the respective categories. The intent of this audit approach is to focus on high-risk areas that are identified in retrospective audits. The focused audits will likely begin in July and August and will only use 2023 claims so that the audits are more contemporaneous than with the claims. Based on the results of the retrospective and focused audits, pre-bill audits will be conducted in November and December. The HIPAA risk analysis and security assessment. As you are aware, the system has engaged Coalfire Systems to conduct the annual HIPAA enterprise-wide risk analysis and security assessment. Coalfire analysis involves on-site visits, remote interviews of key facility and central office personnel, and in-person and virtual walkthroughs of system facilities and clinics, compliance and risk reviews of sample applications, and in addition, Coalfire performs penetration tests on the system's applications to determine their vulnerability to unauthorized access. It also assesses a sample of the system vendors to determine their compliance with the system's HIPAA and the security of the system's PHI. Coalfire has assessed all of the skilled nursing facilities and the acute care facilities. We're in the process of gathering documents and conducting interviews for the neighborhood health centers and school-based health centers, and has begun the enterprise-wide review, which is continuing the security and controls of the system's vendors that have access to the system's PHI. And finally, on April 18th, the Enterprise Compliance Committee met to discuss the draft fiscal year 2024 compliance work plan, which was developed from the fiscal year 2024 risk assessment. The fiscal year 2024 work plan was subsequently approved by the ECC and includes 4 items, one of which is an acute care item, one is a post-acute care item, and 2 are system-wide items. The 2024 work plan is presented to the Audit Committee for approval and signature by the President. And the OCC and the Office of Internal Audits are collaborating on the development of the enterprise risk assessments. The risk assessments will include compliance and operational risks, and the collaboration will allow the departments to share resources and leverage each other's subject matter expertise. The first enterprise-wide risk assessment will be presented to the Audit Committee for fiscal year 2025.
Yes, Rita?
Could you just remind me, what was the billing and coding audit about?
For
That's-
KPMG?
Yeah, KPMG.
They're doing a number of reviews for both inpatient and ED audit. They're looking at a number of different claims,
Just to see if we
depending on
properly.
which facility or which department they're looking at it.
Was this related, not related?
No,
No.
no. Very, very standard
Right.
work for health systems
Gotcha.
to do. Just
Okay.
to-
Thank you. And,
So
What-
revenue impact, potential revenue impact. I
right,
guess.
it
Yeah.
could, yeah. And this is just on the compliance reports that come through, you said there was one red report initiated but never completed by the reporter. Is that just, it's red because of the topic? Is that why?
Yeah, because of the allegation that they selected workplace violence, but they chose to be anonymous, and they never identified the situation, the date, the location.
You have no ability to follow
We have
up?
no way to investigate it.
Yeah. Thank you.
Are there any other questions? I have a quick question. When you talk about incidents being reported and entered into different systems, who is that that's reporting them?
In
Like HIPAA, let's take that.
it could be workforce members, it could be patients that have the phone number to call and report. We also open it up to vendors, contractors, et cetera, so it could be anybody.
So the facilities themselves could report it?
Yeah.
Okay. That was my only question. All right, are there any other questions? Any old business, any new business? There being none, I declare the meeting adjourned.